So, good evening, everyone, and today we're going to look at exercise 6 on page 71, which is our reading exercise. Now, it looks a little bit like this. Can you see? Exercise 6, reading page 71. Now, so let's look at the questions, but we're going to go to exercise B. ¿Vale? Vamos a ir directos al ejercicio B. ¿Vale? Let's look at the questions. So, letter B says, read the text and mark the sentences T true or F false. Number 1, 30% of people have some kind of phobia. Number 2, doctors have created a new drug to cure phobias. Number 3, in exposure therapy, people learn how to relax when they are exposed to something they are afraid of. Question number 4, exposure therapy is always successful. Question number 5, the drug affects the way people learn and remember things. And number 6, the study showed that the drug helped people to lose their fear. Now, let's have a look to make sure we understand, ¿no? Number 1, ¿no? O sea, el 30% de toda la gente tiene algún tipo de fobia. Number 2, los médicos han creado un fármaco nuevo para curar, ¿no? O tratar las fobias. Number 3, en el terapia es como una terapia de choque, pero nos lo van a explicar en el texto, ¿eh? La gente aprende cómo relajarse, ¿no? Cuando están expuestos a algo que les da miedo. Number 4, exposure therapy, ¿no? Ese tipo de terapia siempre tiene éxito. Number 5, el fármaco afecta la manera en la que la gente aprende y recuerda las cosas. And number 6, el estudio demostró, ¿no? que el fármaco ayudó a la gente a perder su miedo. Okay, are you ready? Yeah? So let's read the text, shall we? Now, before we read, I want to clarify the meaning of the word pill in the title, ¿no? Scared of spiders, ¿no? ¿Te dan miedo las arañas? Take this pill. Pues toma esta pastilla, ¿no? So let's read the text. Are you ready? Here we go. There are many different kinds of phobias, and they affect at least a quarter of the population. But doctors believe that they may soon have a cure. They have discovered that a drug, which is given to patients suffering from tuberculosis, can also help people to overcome their phobias. The normal treatment for people with strong phobias is some kind of exposure therapy. The most commonly used exposure therapy involves gradually exposing people to the object or situation that produces the fear. For example, if you have a dentist phobia, you might first sit in the waiting room of a dentist, then talk to the dentist, and then sit in the dentist's chair. These exposures are combined with relaxation techniques. However, exposure therapy does not work for everybody, and doctors think that the new drug, which causes changes to a part of the brain which is used in learning and memory, could be used in future to make this therapy more effective. Michael Davis at Emory University School of Medicine in Atlanta, Georgia, did a study with 30 acrophobics, people who are scared of heights, and put them in a glass lift that appeared to go up and down. The people who were given the pill felt much less afraid than those who took a placebo. Okay, so there's your text. Pause the video now to look at the questions and answer them. Okay? Now, have you got some answers? Let's correct exercise B. Are you ready? So, number 1, 30% of people have some kind of phobia. Well, this is false because in the text it says different phobias affect at least a quarter of the population. Question number 2. Doctors have created a new drug to cure phobias. This is false. They have discovered that the drug for tuberculosis can help, ¿no? Que no es un nuevo fármaco, sino uno que ya existe. Number 3, in exposure therapy, people learn how to relax when they are exposed to something they are afraid of. This is true. And number 4, exposure therapy is always successful. This is false because it does not work for everybody. No funciona para todo el mundo, según el texto. Number 5, the drug affects the way people learn and remember things. This is true. And number 6, the study showed that the drug helped people to lose their fear. This is also true. Now remember, if you have any problems, send me a WhatsApp, ¿no? Si tenéis algún problema, alguna duda, me mandáis un WhatsApp y yo os atiendo, ¿vale? Now, let's look at exercise C. It says, with a partner, bueno, no tenemos partner, pero lo vamos a hacer. Guess the meaning of the highlighted words. So in the first paragraph, we have affect, and affect means to have an effect on, ¿no? Afectar. Also, in the first paragraph, we have cure. Now, cure is a remedy or a treatment, ¿no? Es como un remedio, un tratamiento incluso. Incluso una cura, ¿no? Overcome. To beat or to get over something. To overcome es vencer, ¿no? O superar algo. Exposure therapy. Well, this is to gradually expose someone to their fear in order to overcome their fear, ¿no? Cuando expones poquito a poco a alguien, ¿no? A su fobia o su miedo, para que poquito a poco lo van superando, ¿no? Exposure therapy, ¿no? Que expones a la persona a la cosa que les da miedo, poquito a poco, gradually, ¿no? Gradualmente. Does not work means is not successful, ¿no? No funciona. ¿No? Effective means it has the desired effect or it works, ¿no? Que tiene el efecto deseado o que funciona, ¿no? And placebo is a substance that is not medicine, which is given to a patient who thinks it is medicine, ¿no? Creo que es igual en español, ¿no? Pero es una sustancia que se administra a un paciente, ¿no? Ese paciente cree que es un medicamento, pero en realidad no lo es, ¿no? So there is our reading, ¿no? Any problems, lo mismo, any problems, send me a WhatsApp, ¿no? Para cualquier duda o cualquier pregunta, me mandáis un mensaje al WhatsApp, desde luego, because this is all for today, ¿no? Thanks for listening. More to come next week. Have a great weekend.